Well, Singapore has the highest rate of fractures caused by osteoporosis in Asia, a disease where bones deteriorate and become more fragile. This is set to rise by over 57% by 2035 as the population ages. The Asia Pacific Consortium on Osteoporosis, or APCO, is urging more action to tackle the impact of this disease. It's a topic experts from the region will discuss when they meet tomorrow at the APCO Scientific Summit in Singapore.
Well, two of those experts are here with us this evening. Dr. Philippe Halbout, he is CEO of the International Osteoporosis Foundation and Executive Committee member of the Asia Pacific Consortium on Osteoporosis, and Professor Manju Chandran, Executive Chairperson of the Asia Pacific Consortium on Osteoporosis. Welcome to both of you. And Manju, if I can get to you first, why does Singapore have one of the highest rates of osteoporosis in this region?
Yeah, well, Don, I mean, you kind of partly answered that question. Singapore is one of the most rapidly aging populations in the world. In fact, our statistics are so huge in that currently 1 in about 5 Singaporeans are over the age of 65, but in the next couple of decades, it's expected that 1 in 4 Singaporeans will be over the age of 65. And osteoporosis is primarily a disease of the elderly, so it's an obvious fact that as you grow older and when the aging population increases, you're going to get the absolute number of osteoporotic fractures are going to increase.
Right.
Professor Manju, this is a simple Google, so I can't pretend to know very much. Osteoporosis happens when the body loses more bone tissue than it produces. So I take it old people produce less bone tissue than they would have done if they were younger. Is there any way to, I wouldn't say reverse the process, but maybe supplement the process?
Oh, well, I mean, it's not exactly old people forming less bone. A peak bone mass is attained by the age of about 25 to 30 in all of us. In people with osteoporosis, the bone loss which happens with aging is just more rapid. So bone loss and bone formation are an ongoing process that happens throughout life. But in people with osteoporosis, bone loss exceeds bone formation. Whether you can reverse it completely, probably not. But there are lots of medications available to treat osteoporosis, and of course prevention is always better than cure.
Dr. Halbout, let's bring you in on the conversation now. Looking further afield, many populations in this part of the world are also aging, similarly, like Singapore. Is that one of the reasons why we're also seeing this as a regional issue?
No, in fact, the population, generally speaking, is aging, certainly. But in Asia Pacific, we observed a very, very specific situation. In fact, by 2050, 1 in 4 people will be the age of 60 years and more. And this portion of the population is triple, between 2010 and 2050. Within the same time frame, we are going to observe a huge number of hip fractures occurring worldwide, between 4.5 to 6.3 million fractures worldwide. Half of them are going to happen in Asia Pacific, including Singapore. So you can see that, in fact, if nothing is done, we are not going to have to manage a big challenge. We are going to meet or to face a real crisis.
Well, it's a common misconception, I would call it misconception, to say it's undiagnosed. In fact, given your figures, I would take it for granted that if I'm aged above 65, I have a very high chance of, call it what you will, I am losing bone mass more quickly than I am producing it. We don't even need to diagnose this, do we?
Well, no, it's not a given, right? It's not a given that everyone is going to lose, bone more quickly than, they form
but relatively speaking.
Relatively speaking. But then, I mean, osteoporosis doesn't happen in everybody. There are several risk factors for osteoporosis. We call them modifiable as well as non-modifiable. So the modifiable risk factors, I mean, you can change, right? Your sedentary lifestyle, low calcium in the diet, or there are these other conditions which are associated with osteoporosis. Non-modifiable risk factors, obviously, you cannot change because they're like aging, and just being a female puts you at increased risk of osteoporosis. Being Asian actually, or Asian or Caucasian actually puts you at risk for osteoporosis. So those non-modifiable risk factors we cannot change, but modifiable risk factors we definitely can change. And underdiagnosis is rampant. People just don't think that osteoporosis is a serious disease. And osteoporosis, unfortunately, is what we call a silent disease. You don't even sometimes know that you have osteoporosis till you have a fracture. So that's a problem.
Why is it, though, that it is so underdiagnosed? Because if patients are seeing, their typical healthcare provider, why aren't doctors telling them, you need a bone density test, you need to watch out for this, you're about to hit the big 6-0 or something?
In fact, you have several components that could explain this situation. I like just to illustrate one point. When you have a patient suffering of a fractures, admitted at the hospital for the surgery, and then the patient is repaired by the orthopedic surgeon, 80% of them, 80% are going to leave the hospital without a diagnosis and even less a treatment. And in fact, this is due to, again, different components, but one of them is definitely the lack of prioritization from all the stakeholders, including the healthcare professionals, first. Second, the lack of connection between the specialties inside the hospital. Certainly, the orthopedics are making an incredible job to fix the fracture, but we don't have the connection with the rheumatologist, the geriatrician, the radiologist, the nutritionist, and so on. And to fix this situation, we are implementing what so-called fracture liaison service, that is a kind of journey inside the hospital, aiming precisely to break the vicious cycle of what we call the fracture cascade. What is extremely frustrating at the global level, and of course including Asia, is that we have all the tools to struggle this incredible situation for the diagnosis, as Professor Chandran said. As treatments also, we have very efficient treatments, but unfortunately, lack of prioritization, but we are working hard for that.
So what would count as effective treatment?
Treatment-wise? Okay.
Oh, sorry.
Okay. So treatment-wise, there are several effective treatments, medications. There are several medications available to treat osteoporosis. The problem, like Dr. Halbout said, is that unfortunately it gets, osteoporosis gets submerged amongst the multiple other diseases which a patient has. So, but once it's diagnosed, treatment, there are several medications currently available. All of them work very effectively. Some work by preventing bone loss or by decreasing the rate of bone loss, and there are other agents or other medications available that are even used to actually build new bone. So it's not a lack of medications, it's just a lack of awareness, both amongst, as Professor Dr. Halbout said, amongst physicians and treating surgeons, but also amongst patients, because people tend to think, oh, I had a fracture because I fell. That's it. They don't think the connection between osteoporosis and a fragility fracture.
And it's a very long road to recovery if a person does sustain a fracture. It's not a simple sort of a cascade of other medical events can also occur after that.
Exactly. And in fact, even mortality, people don't think. In fact, we are starting to call osteoporotic fractures as bone attacks, just to give it the same amount of seriousness that a heart attack has, and people can even die, after a hip fracture, which is not well known. People think, oh, I'll just have a fracture, I can get fixed and I can leave the hospital.
Final question, Professor Halbout. Is there a way we can live so that we can prevent this happening? As you mentioned, prevention always better than cure.
Partly, yes. In fact, we certainly to have, a healthy lifestyle, to have a good nutrition, to have sufficient calcium and vitamin D intake helps precisely to build a strong bone health. And of course, IOF and also APCO, we are working hand in hand to promote this approach. But at the end of the day, never forget that osteoporosis is indeed a chronic disease that requires a very serious management. Indeed, just to reinforce what Professor Chandran said, in our countries, where we have access to the hospitals and so on, one patient in four suffering from a hip fracture is going to die in the coming year. Exactly. 1 in 4. For the 3 remaining patients, the 2 of them are going to require a life assistance for their daily activities. So the burden is incredibly huge. In terms of statistics also, 1 woman in 3 and 1 man in 5, because this is also a main disease, age over 50 years, are going to suffer of at least 1 osteoporotic fracture in the remaining lives. So clearly, this is a huge burden that we are facing. we need guidelines, and we work hard with the APCO precisely to change that.
Yeah, it's a sobering statistics and a sobering reality as well.
Yep.
Thank you both for coming into the studios and sharing that with us. That was Dr. Philippe Halbout and Professor Manju Chandran.